Hello everyone! Thank you for joining me in another Jan's Lactation Series video. Every Monday we talk about anything related to breastfeeding products, tips, tricks, pumps, specific breastfeeding topics, you name it, we're here for it all. So today I'm really happy and excited to talk with you today. So today we're gonna have a topic that is very near and dear to my heart. It is about tongue ties. So, and it's not, just tongue ties, it's tongue ties, lip ties, buccal ties, oral tethers. But I specialize with oral function issues. So that is, your oral restrictions. Anytime, baby is having a feeding dysfunction, despite proper technique and everything, and when it's related to the tongue ties, lip ties, buccal ties, that is my area of specialty, that is my niche. I really was not originally trained on tongue ties when I first became a lactation consultant. Fun fact, most medical professionals in pretty much any field do not get tongue tie education in their original training. Similar to me, including lactation consultants, we had to go and get continuing education after the fact and seek that education out on our own to really, in-depth understand what this is, how does it impact families, all that. So over the last 3 years, we've really dove into it and really understood what exactly it is, what does that look like, what are the differences, because they can look very different from one family to the next. I will say any type of oral restriction is incredibly individual. It is case by case. Usually it's not going to look like the same from one baby to the next. And just, kind of hitting that home, if you are worried or thinking, oh, maybe my baby has a tongue tie, and you take baby to go to a provider, any provider, to assess if there actually is a tongue, lip. Okay, I think we came back. Sorry about that. So if you take your baby to go get an oral assessment, make sure to ask them, how educated are you on oral function? What have you done to to learn? What is the continuing education you have specifically done for oral restrictions? Because that's going to look very different from one person to the next, including doctors, nurses, physician assistants, ENTs, lactation consultants, you name it. We all have had to go to get continuing education, but not everybody does get that. So just a little tidbit on a few things to just keep in mind. Because, with this, it's very individual. There's a lot of stories out there, and I do commonly hear, oh, my baby definitely, the doctor said he did not have a tongue tie, and then when I go and assess, there's a different answer there. So just thinking into that. So let's we're going to do, just a touch on this, because this is a really big, complex topic, but it affects a lot of families, which is why I want to talk about it. So we're just going to touch on, what it is, what are the symptoms, what should you do, things to consider. Just lightly touch on all this. This does not replace medical assistance, medical care. So just keep in mind, this is for, educational purposes only, and it's not to replace, any kind of medical care that you should or would be receiving. So what is a tongue tie? Or it's not classified to just a tongue. It is also classified for the other frenulums. So every single person has multiple frenulums. They are basically, for most, they look like a little band, a string of tissue connecting, one specific place in the mouth to another. So everybody has one that connects the upper lip to the gum. Everyone has one connecting the lower lip to the gum, and from the floor of the mouth to somewhere between midline to the tip of the tongue, and then on your lower jaw, those are your buccal ties. That's the one connecting basically the inside of your mouth to your jaw. And same for up top, so 7 for most people. Now, they are only considered tied if there is a restriction component to it. So everybody can have frenulums. That doesn't if you see the frenulum, that doesn't necessarily mean it's a tongue tie or a restriction. It has to do with the function. So a lot of people are, they see the frenulum, oh, that must be a tongue tie. But you really do need a functional assessment to determine, like, if it is actually restricting the range of motion or if it's in with normal functional limits. So having someone who's educated on assessing will definitely help you in the right direction to get that functional oral assessment. And I'm going to tell you right now, that oral functional assessment is usually somewhere around 10 minutes. It's not a quick peek under the tongue and calling it a day. That is only purely looking at the appearance and not the function. And I will say, when I'm looking at a baby with a possible oral restricted tie, I am not looking at just one single thing. The biggest thing to me, I don't care how it looks. The most thing I am caring about is how does it function? And that's kind of the frame of mind for, functional medical care, right? So we want to know, more than just what it looks like on the surface. Go a little deeper. What is actually going on the inside? And that's where the functional oral assessments come into play. So that's kind of what it is, a little bit about those assessments. How does it impact breastfeeding? How does it impact bottle feeding? Because it's not only limited to affecting breastfed babies. It can definitely affect bottle-fed babies too, whether it's formula, breast milk, whatever. It can have a deep play on all forms of feeding. That's one of the first signs that a baby actually has any kind of oral restriction is feeding difficulties or something going on that is providing an ineffective feed for one thing or another. So that's just a little touch on that. Some of the symptoms that I commonly see with the families that I am helping is we hear a lot of clicking, like that. So the clicking comes from the tongue is supposed to cup and wrap around a nipple, whether it's the bottle nipple or mom's nipple. But that clicking is coming when that suction seal around the tongue and the nipple is breaking. That loss of suction is creating that little click sound. And you can have clicks here and there, not a big deal, but if it's a lot continuously throughout most feeds, that would be a sign where I'd be like, maybe you should go get a functional oral assessment. When we have babies who has a lot of milk spillage, where, it's not just like a little bit of dribbles. No, like they have to wear a bib, their shirt is soaked, and it's at most feedings where they're just leaking milk. That also tells me that the tongue is not adequately wrapping around the nipple and providing a seal in the lips. So there's usually a gap in the corner of the lips, making milk spill out continuously, regularly. Another thing can be weight loss, poor slow weight gain. So with tongue-tied babies, there can be an issue where mom has adequate milk supply, but baby does not have the ability to transfer the milk. So we call that a transfer issue. That usually is due to a oral weakness in their mouth. Usually the tongue, can be the jaw, but predominantly it's usually a tongue muscle weakness. So basically, what was it? There was a study that came out in 2019 about tongue ties that had stated it is 25 times harder for a tongue-tied baby to nurse effectively, to suck effectively, than a baby without a tongue tie. So essentially that is telling me that the tongue ties is really expending baby's energy. It's very hard. They have to use a lot of force, a lot of energy to get an effective feeding. And sometimes when you're feeding 8, 10, 12 times a day, they may not have the energy to sustain a full feeding at every feeding. So with that can in turn turn into slow weight gain, weight loss. But that's not always the case. Flip side of that, it's a beautiful biological design. So we have some babies who lose weight or just kind of have a slow crawl of weight gain with tongue ties. But flip side, we also have babies where they have this beautiful design with their moms. Their mom has an overactive letdown or an oversupply for whatever reason, XYZ reason. So the babies are gaining weight or even excessive weight because mom has this overabundance of milk. And with an overactive letdown, we know that those letdowns are sensitive, so baby doesn't have to do too much to trigger that letdown, and then they're getting all this milk. So it can be flip side, either one. So that's why this is one thing that makes, you know, tongue ties so controversial, because it's incredibly subjective. And like I said, what it looks like for one baby is not always, you know, the standard for how it should look for other babies. So you really have to dig in and find all these symptoms. And persistent breast pain at the breast. So when you are doing your end, you know, moms are about 50% responsible for breastfeeding, and babies are responsible for the other 50%. So when you are doing your 50% to ensure that you're facilitating a deep, pain-free, effective breastfeeding, but it's still not working and you're still having pain regardless of having the right technique, doing all that you can to ensure it's comfortable and pain-free, and it's still painful even past that point, or you're still bleeding and seeing damage, that is definitely a time, big sign, that's a time to get an oral functional assessment, so that persistent breastfeeding pain and damage. Excessively long feeds, because remember what I was saying, how babies have to, it takes, hold on, excuse me, it takes babies about 25 times, it's harder for babies to suck effectively about 25 times than a baby without a tongue tie. So that can translate into baby having to compensate somehow. So instead of, you know, feeding robustly and actively for, you know, a good, you know, normalish amount of time, they are instead sluggishly feeding. So using less energy for longer amounts of time to, you know, really get a decent feeding for babies. So that can look like 45 minutes to an hour plus for feeding times. And that can actually, you know, sometimes that's okay, but if that's happening regularly all day, every day, or most of the feeds throughout a 24-hour period, that's a sign. And then flip side, again, because there's usually like one presentation and then an opposite presentation to it. So the flip side to that one would be, I call it a short feed, short nap cycle. So babies who have really short feeding times, like 5 minutes, and then they take a really short nap, like 20 minutes, give or take a little bit, and then they do this on and off all day. And so we see those families where mom's feeding, you know, 15, 20 plus times in a 24-hour period, and she feels like she's doing nothing but feed, nap, feed, nap, feed, nap, and she's kind of stuck in this limbo somewhere in between. So that can also be due to a tongue tie with just, that's the flip side to the long feeding. It's the short feedings. There's a lot of in-betweens.
Thank you for calling Dr. Hall's office. This is Shannon.
So those are a couple of the symptoms, and that's just a couple of things that moms could look out for if, you know, you're considering, oh, maybe my baby has a tongue tie. This could be, you know, something I need to look into. So what comes next after, you know, you get an assessment? Maybe you hear, okay, yeah, this looks like a tongue tie. What should we do? If there's something that I can give to you guys that you will remember outside of this video, it is not a quick fix. It is not all about actually physically addressing it with surgery. There is much more to it. You know, I would never recommend for a family to, you know, hear, okay, you have a tongue tie, and immediately get it cut. There's some pre-work. For most families, there's some pre-work that needs to happen, and there's definitely some post-work that needs to happen. So, and this is just light touching into this. We're not going to go into a big deep dive on it. This is just general education to put you in the right direction. So again, general. For the most part, every family who is considering getting their baby's tongue tie, lip tie, oral restrictions released surgically should definitely be doing some pre-surgery work, which includes body work. So we know that the tension inside, structural tension inside the body has a big interplay on how babies latches, how they feed. So it's incredibly important to make sure that baby is not holding any, you know, physical tension in their body before they go into that surgery, because when there's tension present for the surgery, it'll likely impact the ability for the oral muscles to actually release enough to have a positive outcome. And There's some percentages where this is usually with babies who have, the not obvious posterior tongue ties. Some percentage of these babies can actually be holding, a lot of tension, in their neck and shoulders, head. And because the tongue muscles are so intimately connected with the neck, shoulder, head muscles, it can actually make it seem like baby has a tongue tie, but it's, true root cause is muscle tension, not exactly physical restriction. So for those babies, it's incredibly important to get body work because for, I want to say a percentage of those posterior tongue-tied babies can actually get enough body work done where it improves their oral function and they do not need surgery. So I am on the side of, I would never recommend a family or a baby to do surgery unless I know I'm 110% certain that it's medically indicated. So for a third of the families I see, I would hate to tell them that they need a surgery when there was a chance that they could have avoided it. So that's one reason why body work is incredibly important prior to getting any type of oral restricted surgery or a release procedure, whatever you want to call them. So again, it's not all about the snip. It's not here problem, fix problem, snip. And there's a couple different methods on how to address it surgically. You have your scissors, you have your laser. Some providers don't believe in a full release. So that's where the provider would only cut, or remove the obvious frenulum, where you would see this band of tissue right from the floor of the mouth to somewhere to the tip of the tongue, midline, somewhere around there. So they would cut the outside portion. But it's known many anterior tongue ties also have a posterior portion where the restriction lays, submucosally behind the tongue. These are the most hard to identify cases. The cases that usually get slipped through the cracks, they usually don't get adequate help because it's a hard to identify case, essentially. So little couple ideas, just a light information on that. And let's say, okay, you did all the stuff. You worked with, an IBCLC team leader. You worked for all the lactation things. You worked with Bodywork for all the tension things. And now between all the providers, you decide that you want to go ahead and do the procedure. You're ready for it. All tension has been released. And then you went ahead and you got the procedure done. What comes next? It is incredibly important to do those exercises. So for a full release tongue lip tie, they're going to give you exercises to do after you go home with the procedure. It's incredibly important that you do them consistently and effectively. This portion right here, the after wound care, that is where bad outcomes come from, mostly because parents were not educated on how important this is and, what kind of impact it will have. So if you're not doing them, that's where you may find baby's oral function has gotten worse or it never changed. And you will notice that there's reattachment. So that frenulum will grow back and it will be just as restrictive, if not more. It's highly likely that reattachment is more restrictive than where you started off. That's why those wound exercises is incredibly important, and still seeing that same body worker after the appointment to ensure that no tension returns and causes more restriction in the frenulum. So those wound exercises, it is recommended to do them, I think, every 4 to 6 hours for about 6 weeks. And it's important because a lot of people think, that when they lift the tongue, they lift the lip, it's going to hurt baby. So they do it very gently, which is actually not helping baby. You want to get in there firmly to ensure that the wound is healing properly and it is not reattaching, and very consistently. So just a couple ideas on what this kind of idea would look like if you and your baby have a tongue lip buccal tie that you think you would like to release. This is a big thing. This is a big complex idea, and it's hard to navigate. So I highly, highly recommend to work with an IBCLC. That's an International Board Certified Lactation Consultant. And but make sure that they are educated on tongue ties. The tongue tie savvy IBCLCs are often tongue tie team leaders. What that means is we are very familiar with this, and we see very intimately how does this affect our families, what kind of impacts it has on breastfeeding. So we're very well versed with this. And we have in our pocket a whole network of referral sources that will help you effectively address this whatever way you want to go. And we can, hold your hand throughout this whole process. I know for me, when we kind of figure out what's going on, I give them the referrals for the Bodyworker. We work on that. I reassess their tongue function, oral function to make sure, it's medically necessary. Then we go to the release provider. And then after they get the procedure, they come back to me within the first 3-5 days, and we're reassessing tongue function. We're making sure baby is relearning how to use those oral muscles. We're making sure breastfeeding is becoming more and more comfortable. And if at any time there's, some feeding issues going on, we're going to speech language pathologist. But essentially, from step A, point A to Z, I'm with you. And IBCLC will be with you throughout that entire journey. So you don't feel like you have to navigate it alone, and you have someone telling you exactly what to do, how to get through it, and if you're doing it right or not. So you have someone throughout that whole thing. So that, I know it's a big topic, big complex ideas, and there's a lot of information with it. So I hope that gives you just a brief little touching, a little bit of education on what this is and what that means for you. So thank you guys so much for watching. If you stayed in this long, if you guys have any questions or thoughts on this, feel free to reach out anytime. We're happy to help, myself and any of your Jan staff members. We're always here for you. I hope you guys have a good Monday. Bye.